Let's talk lungs with Trent and Lori from Lung Saskatchewan. Dedicated to connecting you with lung health experts and key opinion leaders who will share current evidence-based lung health information to inspire you and those you care for to take your best breath. This podcast is recorded on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, as well as the territory of the Métis.
On this episode of Let's Talk Lungs, we are talking with Dr. Cora Constantinescu, a pediatrician and infectious disease physician in Calgary, Alberta. Dr. Cora is also a vaccine expert, passionate about vaccine confidence and prevention of infectious diseases, particularly in our most vulnerable populations, our infants and children.
This episode of Let's Talk Lungs is proudly sponsored by Sanofi Canada. Sanofi is a global healthcare company committed to protecting life through the power of vaccines and science. Thank you, Sanofi, for supporting this important conversation. Dr. Cora, thank you so much for being here with us today. RSV, or respiratory syncytial virus, has been making headlines more often lately, especially in relation to infants. Some may hear RSV and assume it's just another cold virus, but we know it can be much more serious, especially for babies. We're so glad to have you help us unpack the realities of RSV in our little ones. So let's start off with a little bit about you. What led you into pediatrics and specifically infectious diseases?
Well, I think infectious diseases is the best field in medicine. I love the detective aspect of infectious disease. And I also love how we can actually provide real cures to people's medical issues, some of which are life-threatening. And there are not a lot of fields in medicine where you actually have new diseases. But in infectious disease, we do have new diseases when you think of COVID and Zika. So it always kind of keeps us on our toes in terms of what we think we know and what we actually do know. And we're also very frontline clinicians. So there's a lot of patient contact, very patient-facing, and I love interacting with my patients. And all this while also being involved in issues that impact the public. So we can also work to change health of communities, not just health of individual patients. So I kind of love what I do. The pediatrics part is a bit more complicated. I did love my adult patients as well. But I think the best part of pediatrics is that you are working to help the child and you have the parents in your court and they're the best advocates for the kids. So it's really nice to always have somebody on your side as you're looking after the health of a child. And kids are so medically resilient, which is also very encouraging because often they face very serious and life-threatening infections. So yeah, that's, I love both aspects of what I do.
Well, Dr. Cora, for those who are listening who might not really be familiar with what RSV is, can you start with a bit of a 101? What are the symptoms and why in particular it can be so dangerous in infants?
Yeah, so it's an interesting virus because it's a super common virus. So RSV is so common that by the age of 2 to 3 years, essentially every child in Canada has been infected with it. And as we grow and age as adults, we also get many reinfections with RSV throughout our life. So because it's so common, it infects so many people, its presentation is a little bit different. So in adults, it may just present with a bit of runny nose or some cough, some congestion. It can just be a head cold. In adults or others who have asthma, for example, it can trigger asthma or some respiratory conditions. But in children, especially infants, they're so small. They have small airways, small chests, and they have very little reserves. And they're also immunologically what we call naive, as in they have not seen the virus before. They don't have protection. So in that group, RSV is very different. So what's a cold in an adult can be a very severe respiratory infection in children. It can end up in respiratory failure. So they simply cannot continue to clear their airways, bring in the oxygen the body needs, breathe out the carbon dioxide the body needs. And they can actually, their lungs can fail and can get into this respiratory failure. And this is why 2%, which is actually a really high number of all Canadian infants, end up hospitalized with RSV during the first year of their lives, because it's so different between, what a healthy adult can experience with RSV versus a healthy but very small infant.
We often talk about cold and flus occurring during specific seasons, but we know that RSV has a season all of its own. So when does it typically strike, and what's been happening recently in terms of its spread and severity?
And it's a tough question because the RSV season is different across Canada, and it's also been different year to year. So typically, you can expect the RSV season to strike somewhere between October to April. So that's typically when we think about respiratory viruses seasons. And it does coincide with people being indoors more, the temperatures dropping, a lot more person-to-person contact within closed spaces. What we have seen with RSV, though, is that even within Canada, you can have different seasons. So in Quebec, for example, the start of the RSV season can be very different than in BC or Alberta. And it's always tough to really predict every year with full certainty when it's actually going to start. In the previous seasons, you can also have a really high peak, could be earlier in the season. So you could have an early high peak season, but you can also have a later high peak season. Again, really hard to predict from year to year. What we have seen, however, is that even in the year post the pandemic, when people had not been exposed to RSV so much, so we didn't have the same exposure during the period when people were masking and physically distancing, that year, we did see older kids having more RSV as well compared to the previous years. But what's really been interesting is that through this whole, even though changes occur from year to year and a bit in terms of ages and who's most going to be impacted by it, the actual age of severity hasn't really changed. So what we do know is that those babies under 6 months of age tend to be more severely affected by it, regardless of when it starts and how it's different across Canada. So that severity has stayed the same.
And then you talked a little bit about not necessarily every infant becoming seriously ill with RSVs, but can you help our listeners understand a little bit more who, again, is most at risk and those factors that would make someone a little bit more vulnerable?
Yeah, so again, up to 2% of all kids in Canada get admitted to hospital due to RSV in their first year of life. When you think of all Canadian, all kids across Canada, that's actually a really huge number of hospitalizations. So it's somewhere between 5,000 to 6,000 hospitalizations. And what else is interesting is that 1 in 5 of those who are hospitalized end up in intensive care. So they have very significant severity. And we know that that is usually associated with those babies who are younger, and especially if those babies are premature. So under 37 weeks or premature infants tend to have a higher likelihood of being hospitalized and especially having intensive care admissions with RSV. And also, there are other children who are impacted in the first year, but also in the second year of life. And those are kids who may have Down syndrome, who have some kind of other chronic illness, especially lung or heart or neuromuscular illness, so they have poor muscle tone, for example. Those kids, or severe immunodeficiency. So we know those kids are at risk in the first year of life, but they're also a risk in the second year of life from RSV. And then another really big group that we sometimes, we have to think about that you see a lot of attention when you look at recommendations and guidelines are those kids, those babies in communities where transportation for severe RSV disease and treatment is very complex. So, for example, think of northern Indigenous communities where, for example, if a baby needs care or a tertiary center, they need to be airlifted to a tertiary hospital. So those also make a really kind of special population and risk in terms of RSV disease.
We are going to take a short break and get right back to our conversation with Dr. Cora Constantinescu.
Lung Saskatchewan has long been associated with leadership in lung health education. Whether you enjoy webinars, videos, printed resources, or podcasts like this one, we're here to support your best breath. Learn more at lungsask.ca.
Welcome back, listeners. We've got the pleasure of engaging with Dr. Cora today. And before the break, we were talking about risk factors, and you'd mentioned a startling statistic about 1 in 5 infants in hospital with RSV ending up in ICU. So we'd like to shift a little bit into protection and prevention. Now, RSV is nothing new, but in the past, we really didn't have many options to prevent it. So, Dr. Cora, can you tell us what's changed?
RSV used to be, and it still is to some extent, an incredibly frustrating virus because we don't actually have any treatment for RSV. We don't have an antiviral for it. So a lot of time and effort has been put into thinking, how can we prevent the actual infection? Because once it hits, we know we cannot treat the actual virus. We can just support the baby as they're struggling through this infection. So the last couple of years have been really exciting for RSV prevention because an RSV vaccine has been in development for over 50 years. But in the last 2 years in Canada, we now have 2 methods of prevention that are highly effective and safe for babies. One is an RSV vaccine given to a mom in the 3rd trimester of pregnancy to protect the baby. And then the second one is a special monoclonal antibody, which is an immunizing medication or an injection given to babies at birth to provide them. And it gives them specific RSV-specific antibodies that last them the entire RSV season. And that one's called nirsevimab. So these 2 methods of prevention, the RSV vaccine given in pregnancy and the monoclonal antibody given to the baby at birth, are the huge, the great news in RSV prevention that's happened in the last couple of years.
Can we explore a little bit more in pregnant individuals how getting vaccinated during pregnancy actually helps protect their baby?
This is one of my favorite things to talk about, which is this miraculous passive immunity that happens when the baby is in the 3rd trimester of pregnancy. So in the 3rd trimester of pregnancy, there is this movement of antibodies across the placenta from the mom. So if the pregnant person has antibodies to a variety of infections, they get passed on to the baby. And that lasts for about good 6 months of life for the baby. And so with the RSV vaccine, we know that it's recommended between 32 to 36 weeks of pregnancy, so in that 3rd trimester. And if you give it to the mom makes antibodies, and then those antibodies cross the placenta and actually protect the babies for up to 6 months of life. And that's important because, as we spoke earlier, that period is when the babies are at the highest risk of severe infection and hospitalization and ICU stay from RSV.
That's amazing information. So let's just dive into a bit more about babies born during RSV season or those with complex medical conditions. So can you tell us a bit about what role do antibody therapies play there?
Yeah, so we have this immunizing agent, this RSV-specific monoclonal antibody called nirsevimab that has been approved for use in Canada. And it's actually been used in the previous RSV season in Quebec and Ontario, and prior to that, it had been used worldwide as well. And it works incredibly well. So ideally, if a baby is born in RSV season, you want to give it as soon as possible after birth because you want them to have protection as soon as possible to protect them through that crucial first few months of life. And this works really well at keeping babies out of hospital and out of ICU. And it works well for babies with prematurity and those high-risk conditions we talked about, but it also works really well for term babies who are otherwise healthy babies. And that's important because we know that 75% of all babies admitted for RSV are previously healthy. So I just want to highlight that in terms of RSV prevention, a universal RSV prevention program that is one that's available to all babies is really important. Because until this last season in Canada, we just had a very targeted high-risk RSV prevention program. But now with the availability of this antibody, with this nirsevimab, and also the availability of the RSV vaccine, we can actually aim for a universal RSV prevention program for all babies, including term babies, who we know make the largest portion, just by virtue of number, of our hospitalized babies.
Well, we certainly know we've come a long way in respiratory virus protection, and with that, there are new technologies and new questions. Are these vaccines and antibodies safe, and what do we know so far?
The short answer to that is that yes, both the antibody and the vaccine are both safe. Now, you can have some local reactions, so sore arms, some muscle aches, sometimes reported headaches or fatigue can occur with both of those, but those are pretty small things when you consider how significant the illness that they prevent is. And what's really neat is that we knew that they were safe, so we had this pretty good safety profile from the initial phase 3 trials that were done. But we now also have real world use of these agents data that shows that they're safe and effective, because these strategies have been used 2 seasons ago in the US, in Europe, in South America, and then most recently in last RSV season, they were used in Quebec and Ontario with very close surveillance around safety and how well they work. And so now we have data, not just from the initial studies that were done, but also from the real world, which should be very reassuring for parents.
Dr. Cora, new parents of growing families, we're hearing from them and they're feeling pretty overwhelmed. Talking about flu and COVID-19 and now RSV, so many respiratory viruses and just so many options for prevention. So what advice can you give families navigating this decision-making process?
I tell you, I have 3 kids. My oldest is now a teenager, and I still feel a dread about the upcoming respiratory season and the many illnesses that plague families. And it's really hard on parents because whereas the many respiratory illnesses are so difficult on the whole family, we also want our kids to be in many activities in school and have well-rounded lives. But also, I guarantee you that in the midst of it, if you talk to a parent, they will tell you what an impact this respiratory virus has on their family, especially when you think about loss of work. So if your kids are sick, you have to stay home to look after them, and of course, you can get sick as well from them too. But as parents, we are not helpless. We can teach our kids about good hand hygiene. We can ask sick family members to stay away from newborns and babies. And we can keep our unimmunized infants away from crowds and public spaces, for example, in places like Alberta, to avoid measles exposure. So we're not helpless. There are lots of things that we can do to prevent disease in our children. And now we can also offer our kids whatever respiratory pathogen immunization we can. So if you are a pregnant person, get the flu, the COVID, and the whooping cough vaccine. And if there's no nirsevimab program in your province, get the RSV vaccine, because these vaccines have all shown to actually protect the baby in the first few months of life. And we know that your baby can get protection from that. If your province has a nirsevimab or a monoclonal antibody program for RSV, make sure your baby gets that, because it protects them in those first few crucial months. And then for babies and older kids, there are a few other respiratory agents and vaccines against them that are really important. The pneumococcal vaccine, the yearly flu vaccine, and of course the measles vaccine, because we can see what measles outbreaks can do in certain provinces. So we want to give our kids as parents the best chance to be healthy, but also thrive and have, full lives. And vaccination enables us to do that.
Well, Dr. Cora, we are coming to the end of our time, but before we wrap up, what gives you hope? What's exciting you right now in the field of pediatric infectious respiratory disease prevention?
I get really excited every time there's a new vaccination or immunization product that's safely available to parents that can keep kids and babies out of hospital and out of ICU. I tell you, it is morally distressing for any healthcare worker to see a child admitted to hospital from a vaccine-preventable disease when we think that it could be prevented. So having new, safe immunizing options is incredibly hopeful to me. But I'm also hopeful that parents still trust us as healthcare workers, especially in this time of so much misinformation and mistrust. And I'm really grateful that they still trust our recommendations. And we have a vaccine hesitancy clinic in Calgary, and I'm always so humbled and excited to see that parents are still keen to have a conversation around vaccines and immunizations. They're still keen to get educated and empowered to make immunization decisions to protect their kids. So I'm still really hopeful around a lot of bad infectious diseases we see. I'm hopeful when it comes to prevention and when it comes to empowered decisions that parents can make.
Dr. Cora, thank you so much for joining us today. Certainly your warmth and your practical advice and all your insights into RSV and the incredible progress being made in preventing serious illness in infants are just so valuable. So we appreciate the work that you're doing to protect our smallest and our most vulnerable. And thank you again for sharing your time and expertise with us on Let's Talk Lungs.
Thanks for listening. If you enjoyed this episode and you'd like to help support LungSask's Let's Talk Lungs podcast, please share it with others. Post about it on social media. Like, subscribe, hit that notification bell for new episodes, and leave us a review. Follow LungSask on Instagram @LungSask and on X @LungSask. That's all for this episode. See you next time. Produced at Sound Lounge by T-Bone.